Today we're interviewing Dr. Gerald Joseph. Dr. Joseph has been so involved with ACOG, and you will hear about that as we go through this interview. But Jerry, I'm going to start from the beginning. Tell us where you were born and where you grew up.
Well, we have a little bit in common there, Hal. I was born at the same hospital that you were born in New Orleans, Louisiana, the Old Baptist Hospital. I was born slightly before you, but I was part of the early baby boomers, and I know you were too.
Yeah.
And we have that very much in common. And then my father was finishing his medical training in those days, and we moved to Baton Rouge, where my father practiced ear, nose, and throat medicine for the rest of his career.
Well, growing up in Baton Rouge and having a father and a medical family, when did you decide that medicine was going to be the career for you?
There was never another choice. I never thought about anything else. Not only was my dad a physician, his older brother, my only other uncle or aunt on his side, was also a physician. He was an internist in Baton Rouge. So we had docs on both sides of my brother, my father, and so I never thought about being anything else.
Can understand that.
Yeah.
And when you went to college at LSU?
I did. I grew up in Baton Rouge. I always thought I was going to go to Tulane Medical School, Tulane undergraduate school, like my father did. My mother went to Newcomb, and that's where they met. Towards the end of my senior year, after the fall football, a coach came to me from LSU and said, would you like to come over and play football for LSU? And my jaw dropped, and that was the end of that.
So you played football at LSU?
I did.
And I think I'm aware of a few highlights of your career
well,
at LSU.
I had a fun time, and I was very lucky. And when you get a little older, the best luck you ever had was that you never got hurt bad. And that's what I can still walk. I've never had a knee replacement or anything else like that, and I'm in one piece, and I've enjoyed it. And one or two times that was really fun.
Tell us about intercepting a pass in the Cotton Bowl. Is it 1965 or 66?
It always gets hazed at me, but I think it was a 66, January 1st.
Yeah. And to save the game for LSU. What was that like?
It was interesting. The best part of the story, however, is that the facts are that I did intercept the ball in the fourth quarter. We were ahead 14-7, and they were driving, and I did intercept the ball. And we kept the ball the rest of the game and won. But prior to that, I had also given them a touchdown. I say given them one. They had a very, very wonderful wide receiver. He was an All-American. And I watched him catch the ball right over my fingertips and prance into the end zone for the first touchdown of the game that put them ahead 7-0. But
so you paid them back.
Yeah, I did. But I had the great opportunity years and years and years later. We had children and grandchildren, and we were going on a vacation up in Arkansas, and it was Arkansas that we beat. This gentleman, really nice guy, had played a little professional football after that, and he was in the Arkansas legislature, a big talker, and we went to his general store called the Crockett General Store, which was the only little store around where we stayed in Arkansas. And I walked in, and he and I were the only ones in the place, and he was behind the cash register. It was obviously his place. And he said, hi, don't I know you? And he's a politician now, don't I know you, I said, yes, you do. We've met before. And he said, oh, I knew it. I knew we've met before. And I said, no, we've met before. And he looked at me with a little puzzled look. And so I went through the whole history. And first thing he remembered was not the interception. First thing he remembered is that he set, put me in my place. He set the single game record for receiving in the Cotton Bowl up until that time. And I guarded him man to man over the entire field. So it tells you how great a contribution I had. I did intercept one pass.
It was, it's all about timing.
That's
it's
right.
The right thing
That's
at
exactly
the right
right.
time.
Yep.
So where did you decide to go to medical school?
Well, my dad had gone to Tulane Medical School, and I'd gone to LSU undergraduate, and I went to Tulane Medical School. My dad wanted me to go there, and obviously it cost more to go to Tulane, but that's where he really wanted me to go, and so that's where I went.
And what then directed you into obstetrics and gynecology?
I thought I was really going to go into ear, nose, and throat for the longest period of time, and I went and did a residency, internship, a general internship. In those days, you did general internships, and I did a little bit of everything. And when I did my block on obstetrics and gynecology early in that time, and I just loved it, and I just said, this is what I have to do. And he was disappointed.
And you trained at
I trained at LSU in Shreveport, at the LSU Center up there in Shreveport. And I had previously worked at the Ochsner Clinic as an extern job during medical school, and that's how I got to know them and they got to know me. And so after my training, they said, we really want you to come back and practice with us. And that's how I ended up in New Orleans with them.
Well, your career in New Orleans is we're going to walk through because it has so many wonderful levels. But you did not take a fellowship. You went straight from residency into practice.
I thought about a fellowship. Fellowships in those days was just something that was beginning to be discussed in many places, and a few fellowships had developed. But you know what? Every time I did one part of obstetrics and gynecology, I did another. I loved them all more than the ones before, and I just didn't know how in the world I would decide. There was a time way down the road after 5 years in practice that I actually went and looked at a fellowship in reproductive endocrinology. It was V.Z. Buttram in Houston, and he looked at me and he said, Jared, why do you want to do this? I mean, don't you do it already? And I said, yes, sir. And he said, well, don't you love the other things that you do also? And I said, I really do. And he said, well, pardon me for saying this, but you're crazy to come back and spend 2 years of your life, and you've already got a family and everything. And so anyway, he made me see things. And that's about the time I really started getting interested in ACOG. One of my partners and one of my mentors, Dr. Bill Gary, was at that time the Louisiana section chair. And I had just joined ACOG. And Bill came to me one day and he said, Jerry, I wonder if you could help me out. Our secretary-treasurer for the ACOG section, who had done a good job, just he's done, and he really doesn't want to do it anymore. And he said, I wonder if you would finish his unexpired term and help me out, because as you know, I'm the chair of the section. And I said, well, sure, anything for you. And that was the last.
That opened that door,
That
didn't
did.
it?
And it never closed.
We'll go down that hallway in just a minute. So you went into practice at Ochsner.
Yes.
And then got involved as Louisiana section secretary-treasurer.
Correct.
Tell me about how your practice was. Were you in a group practice?
We had group practice. The Ochsner Clinic was different than many places. It had, I guess, this was before my time now, but I guess looking back historically, it had kind of a tough time starting because it was a group, multi-specialty group practice, which at the time was not particularly popular with physicians.
Right. Probably
Probably still not popular with older physicians. But I really enjoyed it, and I always loved my time there.
Well, what would you say are the most important aspects of your career, your practice or OBGYN career, were after you got started at Ochsner?
I guess you can remember the patients that you really helped. You can remember, unfortunately, the patients that came to you. This is before the days where we had oncologists and a lot of oncologists in GYN cancer, and you took care of some of them, and you remember those that didn't do so well, the ovarian cancers and things like that. But delivering babies that was fun, and being part of the families of people that's really, I guess, where I got my greatest kick, so to speak, in obstetrics, was that you were really part of the family.
Yeah, it's all about the people.
It is. It's all about the people.
Were there any people who really then influenced your continued development as an obstetrician gynecologist?
I guess certainly Bill Gary did. Dr. John Weed, who was the chair of the department back in those days, outstanding surgeon, and he, at the time before he died of a heart attack, he was very, very big in reproductive endocrine and the American Fertility Society, which was a big thing in those days, and he got me very interested in the American Fertility Society, and that waned as my ACOG activities got more and more.
Well, knowing a little bit about your career, I know ACOG is a huge part of it, but you also got into some academics.
I did.
How did that transpire?
Well, LSU, you know, when you were a faculty member at Oxnard, like I was, and we had our own residency training program there, and it was there basically when I came there. It grew under Bill Gary, who was a department chair just before I was fortunate enough to be department chair, and the residency grew to, we had 5 residents a year, and at one time, you know, 3 we thought was the max we could support. So we had 5 residents a year, and I really enjoyed that, and I got involved in that, and then at Tulane and at LSU, I was a visiting professor there also. So, but I spent most of my time teaching our residents and some really great ones. Dr. Al Robichaud, who is now the chair of the department there, was one of my residents, and I remember Al coming, and he did his internship with us. So I've known Al since he graduated from medical school.
Did you chair the program there at Oxnard?
Mm-hmm.
And so, as you were doing that, how did your ACOG transformation go?
Well, it was very, very, very lucky. I got involved in my last year as section chair in Louisiana with District 7, you know, like District 4, a wonderful district with wonderful leaders all over those states. They were fortunate enough to, at least I was fortunate enough for them to ask me to continue to move up the ranks there, and I did. I was the program chair, and then the secretary treasurer, and then the vice chair, and then ultimately the chair. So I pretty much had a chance to do it all.
You did all those jobs.
I did all the jobs. So I was in ACOG for, I don't know, I counted it up one time, I don't know, 27, 30 years, something like that, as an officer.
And then you became ACOG President.
I did.
How was that?
That was wonderful. Now, the best part was being ACOG President. Perhaps the worst part was the timing of it. For me, the timing of it was when President Obama first came to the White House, and healthcare legislation was really churning, and I ended up spending a lot of my time with Lucia Devenir, who's just a fantastic person at the college, as you know, and in government relations, and working on what is now today called the Affordable Care Act, or Obamacare, depending on which term you might want to use. But I was very proud of it. You know, as you know, we worked on this together. We ultimately came this close to signing on to it. There were a few things about it just relative to physicians that we didn't, but what I was so proud of is the things, and I know you are too, the things that we got for women's health care. And I just hope none of that gets taken away in the new Republican.
As we're trying to deal with Trump care.
Yeah, exactly right. Exactly
trying to figure out the same sort of crisis maybe from a different perspective that you dealt with when you were president.
But we had we made wonderful progress in women's health care during those years, and I was very, very proud of that. And then I became the past president as you move on. And then one day, after the last executive board meeting as past president, I was called by you, Jerry, I want to talk to you. And I said, oh, okay. So I thought to myself, what have I done? You know, what have I done wrong? And then you talked to me about the potential that I could come up and live in D.C. and actually work for the college as a vice president. So I probably was one of the few people in the college that went from president to vice president.
You and Harold Kamenetsky are the only two.
Right. But I mean, in successive years, I went from president to vice president. Yeah.
And then you were vice president for practice.
Right.
And then vice president for fellowship.
Yeah, I was. And I just loved my days at the college, and loved the staff there, and only you know how wonderful the staff there is, and they are just truly just great. And coming to meetings like this, the big ACOG meeting, and seeing them all is it's just so wonderful for us and for my wife Helen.
Yeah, I think you're the only person who has been president of the college and has had 2 vice president roles on the college staff. I think you have a unique position in ACOG lore.
Well, I loved every minute of it. There's no question about that.
Well, when you look back on what has been just a wonderful career, what were your most memorable experiences outside of the interception back at the time?
I think my most memorable experiences was really the people. It's like you said, it's really all about the people. I just really enjoyed working with the people. They were uniquely wonderful, talented, and it made my job so easy, because all I had to do was say, what do you think about this? and pretty soon I had a plan developed based on what they told me they thought about this. So yeah, it was great.
Any one particular accomplishment or
I think
goal
that
you
one
reached?
of the things that I look back on today was the 39-week rule. That was one of the big things that we accomplished. Don't deliver babies electively before 39 weeks. And I was astonished at how fast that caught on. Now, given that my history is relatively small compared to the history of obstetrics, I think it was you or somebody that made me realize that way back in the 1980s or something, there's a rule, the college guideline, that you don't deliver babies before 39 weeks unless there's a medical indication. And we were not following it, and I was as guilty as the next doctor practicing OB. Somebody got to 38 and a half weeks, and they were going out of town, or I was going out of town, and I really wanted to be there. I wanted to be part of it, and their cervix was very favorable, and I said, sure, let's do it. And
well, we've all done that, I think. I think your course through your career has also been enhanced by the wonderful marriage that you have.
Oh, fantastic, yes.
I mean, you and Helen have just had a great life.
We have had a great life. It's been wonderful. We've been blessed with 3 wonderful kids. We've just been very happy, and for the whole time. I mean, literally, we rarely, if ever, have arguments. I mean, literally. And just, we enjoy being with each other. And somebody wrote in the paper the other day, in the local Hammond newspaper, which is the local city where I live now. This is on Facebook, and he said, this guy's a lawyer in town, and he says, there's this couple that walks every day, and they pick up trash around the university, the Southeastern University, which is right there in Hammond, and they look like they're their best friends, this guy's just speculating now. He said, I'm dreaming up this stuff, but I'm thinking this guy used to be a football player in high school, and the girl with him was the cheerleader. Well, Helen wasn't a cheerleader. The high school football was correct, but the biggest thing is that she was on the homecoming court at LSU. So he was pretty close. He was pretty close. But what I liked, what he said, they seem like they're each other's best friends.
Yeah. Many of us have commented, it's hard to tell who loves ACOG more, you or Helen.
That is correct. And she has been a staunch supporter of the college and of what I've done and what we've done together. Yes.
Well, I'm going to go back into OBGYN as we get toward the end of our interview here. Our specialty is a specialty in transition. And if you were counseling young physicians today who are coming out, would you recommend that OBGYN would be a good specialty for them?
I absolutely would. I think that there are a lot of wonderful specialties. There's no question about that. I think that if you're a people person and you like people, obstetrics and gynecology is for you. The other thing that I think is very nice about obstetrics and gynecology is that there's so many subcategories that you can go into and be very happy doing that. You can do infertility work, you can do specialized surgery, you can do oncologic surgery. There's just so many different things that you can do.
What do you see as negative aspects to our specialty?
Well, I think that the negative aspects, as we all know who practiced it a long time, is that it's very demanding. It's hard to get away from. And the truth of the matter is, you don't necessarily want to get away from it because you love it so much. You don't want to go out of town on a vacation with your family and leave Mrs. Jones 38 and a half weeks with a favorable cervix because you want to be there when that baby's born because you become part of them. I guess those are the big things.
How do you see the future of OBGYN? You know, in these times, and healthcare changes, and technology changes, and our residency makeup changing. Where do you see our specialty going?
Well, I think it's. I think we've got some challenges. I think the fact that, as you pointed out this morning, and we've known when I was at the college, the demographics of the sexes as to who goes into obstetrics and gynecology has changed since you and I were in our prime practicing. More and more women in the field, and perhaps in a few years it may be 75% females. There is nobody who, and I say this in a very generic way, there's nobody who loves females more than I do. I always tease my wife, I'd rather be with her group at a party than go with the guys and talk about hunting and fishing, although I love hunting and fishing. I think that women just do more things in life. Men tend to get a job, do their job, and do it till retirement. Women are responsible for raising children, having children. It's a little bit different mode, and they want to accomplish more things in their life than just being a career doctor. And that makes it difficult for them, and it makes it difficult for our specialty because they tend to back out of our specialty perhaps sooner than males do.
So workforce issues maybe something we're going to have to deal with down the stream. Well, you know, I could go on and continue asking you questions, but with all of your wealth of experience as a clinician, as a teacher, a chair, I know you directed a health service group in Arkansas, Missouri, and then all the roles you've played with the college. What would you like to say to people who are going to look at this tape 5 years from now? What would you want people to hear from you as a take-home message?
Well, I guess the main thing is that Gerald Joseph was some lucky individual all the way around. I enjoyed my career. I have enjoyed my family. I've enjoyed my marriage, and all the things that I was born with. So I've been very, very, very lucky, and do count my blessings.
Well, Jerry, we count our blessings that you've been part of us.
Oh, thank you.
And you are a special person, a special physician, an amazing leader at ACOG. You know, I feel privileged having had the opportunity to work with you at ACOG, and now to have this opportunity to interview you today. So,
well, it's been great for me too.
I want to thank you for all that you've done.
And thank you. And working with you, Hal, has been a really big, wonderful part of my career.
Well, it's like that feeling is mutual.
Thank you.
Thank you very much.
Thank you.